Hi, this is Dr. Kingston, and we are going to talk about the muscles of mastication. Our objectives here are to thoroughly describe those muscles of mastication. We'll talk about their attachments, their innervation, and their actions, and then we'll talk about the two that comprise the masticatory or pterygomasseteric sling. The job of the muscles of mastication is to move the temporomandibular joint. So to start off with, I am going to just do a quick review of exactly which movements we're talking about here. So recall that the TMJ is separated into two compartments by its articular disc. The superior compartment in orange sits between the articular disc and the temporal bone, and this is where gliding motions happen. So we have protrusion, moving that mandibular condyle forward onto the articular tubercle, and then retraction, moving the condyle back into the mandibular fossa. The inferior compartment over here in yellow then is between the disc and the mandibular condyle. The mandibular condyle has that nice rounded shape to it here, so this is where rocking or hinge movements happen. Depression will open the gap between the maxillary and mandibular teeth, and elevation then will close that gap. All right, with that in our back pocket, let's start just by naming the muscles of mastication. There are two that sit in relatively superficial positions. So we've got temporalis here up in the temporal fossa, and the masseter, which attaches to the external surface of the mandibular ramus and the zygomatic arch. So this muscle right here. The other two muscles are deep to the mandibular ramus. So in the second picture here, that has been chiseled away for you. So these are sitting entirely within the infratemporal fossa, and these are the pterygoid muscles. We have a lateral pterygoid muscle coming from the lateral surface of the lateral pterygoid plate, and a medial pterygoid muscle coming from the medial surface of the lateral pterygoid plate. So let's walk through these and talk about them in a little bit more depth. Temporalis is one of our external muscles, and its belly is located mostly up in the temporal fossa. Its fibers condense into a dense cone-shaped tendon that will travel deep to the zygomatic arch and attach to the coronoid process of the mandible. So in this image up here, which shows how these muscles work when the mandible has been depressed here. You can see the temporal muscle is inactive. Its fibers are stretched out, but it lets you see this anterior attachment here on the coronoid process and how it goes from being this big, wide, flat muscle down to this cone-shaped tendon here. All right. When temporalis contracts then, so this is it stretched out, inactive, when it contracts, it will pull that coronoid process back up and posteriorly. So we say it elevates the mandible and it will retract the mandible. All of the muscles of mastication that we're going to talk about here are innervated by branches of the mandibular nerve, or V3. Temporalis is specifically innervated by the deep temporal nerves that branch from V3. The masseter muscle originates along the zygomatic arch and then extends inferiorly over the superficial surface of the mandibular ramus. It has attachments then to the ramus and to the angle of the mandible. Now, if you look at the direction of the masseter's fibers, you can see that they don't all travel in a single direction. So we've got some pointing anteriorly and then some pointing posteriorly. And this allows different portions of the muscle to activate at different times and contribute to different movements. So when the mouth is open in our top image here, the masseter muscle will provide some protraction. When the mouth is closed, the masseter elevates the mandible and retracts the mandible to pull it into this position. Its innervation, just like temporalis, is going to be a branch of V3. This time it is the masseteric nerve. The medial pterygoid muscle is sort of situated like an internal masseter, so just on the other side of the mandibular ramus. It takes its origin from the medial surface of the lateral pterygoid plate, That's a mouthful to say, but it just refers to the inner surface of the lateral pterygoid plate. And it's also going to have a little bit of origin from the surrounding bones, so from the maxillary tuberosity and the palatine bone. It's then going to travel posteriorly and inferiorly to attach to the internal surface of the mandibular ramus and again the angle of the mandible. This puts it in a position to protract the mandible to open the mouth and elevate the mandible to close it. Its innervation comes from the nerve to medial pterygoid, and I hope you are beginning to notice a trend here. The motor branches of V3 that supply the muscles of mastication are all going to take the same names as the muscles that they're going to. Together, the medial pterygoid and masseter muscles make up what's called the pterygomasseteric or masticatory sling. I want you to know it took me 5 different takes to say masticatory correctly. Both of these muscles will elevate and protract the jaw, but they're also important in supporting the mandible during rest. So the mandible kind of hangs from its articulation with the temporal bone. Gravity is really working against it. I mean, even when you're opening the mouth, a lot of that movement happens passively just by stopping the muscles that are firing that keep the mandible elevated. And you just let gravity take it for a ride. So we've looked at a couple of different ligaments in other learning objectives that help to reinforce the joint, but having a muscular sling like this also helps to support the TMJ, and it prevents the mandibular condyle from getting pulled out of place inferiorly. All right, last but definitely not least, here is the lateral pterygoid muscle. It has 2 heads. The superior head originates from the greater wing of the sphenoid, and it travels posteriorly to insert on the articular disc and TMJ capsule. The inferior head starts off just a bit lower and more medial on the lateral surface of the lateral pterygoid plate, and that is going to insert on the pterygoid fovea of the mandible, which is very close to the condyle. That means that the lateral pterygoid is in prime position to protract the mandible, and it is indeed the most powerful protractor out of all the masticatory muscles. Its inferior head is also capable of depressing the mandible, and it is the only muscle here that is in a position to do. Most depression of the mandible is passive, but that lateral pterygoid is able to contribute just a little bit of power to that movement. So, long story short, it is quite active when the mandible is open to its fullest. And of course, it is going to be innervated by the nerve to lateral pterygoid, again from V3. All right, so instead of doing a review question here, I would like you to, again, pause the video and think for a moment about which muscles are active during to pull the mandible into each of these positions. All right, so let's walk through these. To move from rest into depression, we are going to first fire the lateral pterygoid muscle. Then to protract, we continue firing the lateral pterygoid muscle, kick in the medial pterygoid muscle, and component of the masseter will assist in protraction. So now we are fully depressed and fully protracted. If we want to then retract the mandible, pull our condyle back into the mandibular fossa, we will fire the other part of the masseter muscle and temporalis. And finally, to elevate the mandible, we will fire medial pterygoid, masseter, and temporalis. All right, so some of those muscles, remember, will have multiple different actions depending upon how they're going to move the jaw around. So practice through these a few times. And that is going to bring us to the end. So thank you very much for joining me.